You're watching the Randy Alvarez Marketing Report. I'm Randy Alvarez. Today's topic, a better implant, improving your implant practice with the Sargon implant. With us, we have the inventor, Dr. Sargon Lazarof. Dr. Lazarof, welcome to the program.
Thank you. Thanks for your invitation.
Okay, you've been placing and restoring implants for how many years?
Since 1988.
Okay.
So that's about 26, 27 years.
Now, you have a great story. We should mention this is FDA approved.
Yes, since 1994.
This implant,
yes.
For immediate loading.
Yes.
Okay. It's a different kind of an implant. Let's start with this short video. What are we looking at here on this video?
This actually shows the procedure and shows how the implant expands in bone and locks itself in bone and doesn't require time for it to heal before placing the load on it.
Okay, good. Now, you came up with this idea. You told me. You had already been involved in dental implants.
Yes.
4 o'clock in the morning, you get this idea.
Yes.
Tell the story.
Yes. Basically, I was sitting in an implant course, and the instructor was talking about waiting for bone to heal to the screw. And this thing came up in my head that maybe we should have the screw go meet with the bone and have it lock in. And a few days after that, I woke up at 4 o'clock in the morning and woke up my wife, and I said, why can't we have a design where it actually expands just like a molly bolt and locks in bone?
Like on a wall without a...
Yes.
Okay,
yeah,
like artwork on a wall.
Exactly, yeah.
Okay.
It's an interesting example. This is if a dentist only works with screw implants. If you ask dentists with implants, they have the screws and the mini screws. There's another category of implants, which is the expandable implants. Just like the handyman that comes in and can only put screws in the stud and hang artwork on studs, the guy that needs to do it everywhere, which bone in the jaw has hard bone, soft bone, this implant is placed and locks itself in bone, and the amount of expansion it has, it depends on the softness of the bone. And naturally, in the jawbone, as you move back, you have softer bone, and in the nature, you have multi-rooted teeth. This implant expands more in the posterior area and acts as a multi-rooted tooth.
How do you take it out if there's a problem?
It's reversible. This is a very good question. Just like when you expand it, it has a device that then collapses it, and you can unscrew it just like a screw.
Okay. Now, isn't there where if you put pressure against the bone, you lose bone?
That's what we had to prove. 25 years ago, that was the biggest challenge, and typically dentists said, well, we put pressure on bone, bone dissolves. Orthodontists,
yeah, isn't that true?
Yeah, it's true, with light pressure. When you have orthodontists moving teeth, they do it very slowly because they know that if you put light pressure on bone, bone dissolves, and you can move teeth around. But the orthodontists also know that they taught me that if you start doing it too fast, bone gets denser and actually starts destroying the tooth, resorbing the tooth. Now, that's the idea. When we go in there, we put 20 newtons of force, we actually microfracture the trabecula, the soft bone inside the hard bone. We have the cortical bone, and we have the softer medullary bone inside, and those are trabeculars. So this goes in there, actually compacts those, microfractures them, and expands and locks in there. And then the histological slides show that with time, those are all reconformed and osseointegrate. And this implant integrates not only on the outside, also on the inside, increasing the surface area of the implant.
Okay. Now, for those people that are watching this, they're already placing implants, right?
Yes, yes.
So they get this, because I don't get exactly what you're talking about, right? Why should they change?
Because there's a
and the implant's about $700, $650 with all the parts?
More like $400.
Okay, so about $400.
Yeah.
Why make the change? They're happy. Things are going pretty well. Patients don't mind waiting 2 months. 4 months?
Because patients do mind, and patients do mind. If they find out that there's a way that gives them the tooth in full function immediately and prevents the bone loss and the gum loss that comes with the traditional technique, they will go for this technique. The dentists that are just doing screws, they're avoiding a whole side of the practice, growth of the practice, by telling the patients that come to them, and they know about dental implants and they know about losing their teeth. They can look at that patient and say, I'm not going to make you wait months. You don't have to wear dentures for months.
Okay.
I can take out those teeth and give you teeth in a single visit. 1, 2, 3, 4, all your teeth. I can do this procedure and you can walk out eating and chewing with the teeth.
Okay, aside from being able to do this right away fast, Is it a better implant for other reasons?
Yes, yes,
Why?
histologically. There's several reasons. And this is, I feel like it's more important biologically than the immediate load factor. Typically, anyone that is in implantology knows that cylindrical screw type implants, because of their design, it's a cylinder and you put load on it, which chewing forces. With time, it's accepted that you lose a certain amount of bone on top. It's 0.2 millimeters, the industry standard, that slowly you start losing bone. Because when you take a cylinder and put forces on it, side forces, it's concentrated at the crest of bone. And then you get that cratering and you start bone loss. With the Sargon implant, it expands and it becomes an Eiffel Tower. That Eiffel Tower, the studies have shown that it transmits those lateral forces to the apex. Lower to the deep part, not to the coronal part, and you don't have that traditional bone loss that occurs there. And
do you have proof of any of this that you're talking about?
Absolutely. We have histological studies that show that. And we have studies that show actually the density of the bone increases with time, because with this implant, because the bone is under pressure, it's called an area of oscillation. When they did the histological slides on this thing, they noticed that there's an area of increased density around this implant because the bone is being grown under pressure.
So okay, you've been doing this 25 years.
Yes.
How many years have you had this expandable implant? The Sargon
this
implant.
procedure, I've been doing it for 25 years. I've been
What's your
doing implants
success
for
rate?
27 years.
You must know your success.
Oh, in my office, the success rate is better than 97%.
97%?
Yes.
Success determined they don't fall out?
Yes.
Okay.
No, the success is for the implant to be comfortable,
okay,
aesthetic, functional, and patient has to be happy with it.
Okay, now I'm not a dentist. Logically, it makes sense to me. When I see that animation, and if you're saying putting pressure against the bone doesn't cause a problem, then, and does it cause a problem for some people?
No.
Okay,
no.
So it's not an issue with that immediate pressure.
No.
Then why aren't all dentists doing it? Because it's not an expensive implant.
Exactly, because any idea that revolutionizes an industry gets its own challenges, gets its own attacks, gets copied, and we have all our challenges. And we had, our court cases, which fortunately I can tell you that we won.
But if it's so good, why isn't everybody copying you?
Well, they can, because I have over 17 patents on it.
17 patents?
Yes. So
how much money have you spent on getting patents? Hundreds of thousands of dollars?
Just protecting it, over $1 million.
Okay.
The patents and protecting them, because they say no patent is good until it's proven in the court, and that we've done that. So that by itself, it takes years. And also, dentists are easily swayed by some guys that have interest in other companies. They tell them things such as, how do you take, the simple question that you ask, this implant is expanded, how do you take it out? With the correct instrumentation, you can collapse it.
Some people might say, well, Sargon, he was big, for a while, started, 10 years ago, he went away.
Yeah, Sargon.
You're back? Is it
yes.
a different, more improved, or is it the same?
Yeah, he went away because I was in marketing. I was protecting my patents and my studies. Okay. You can go to the internet and you see all the cases that have gone up to the Supreme Court, and unfortunately I can tell you we are back.
So the bottom line, though, is you prove that this works, it's effective.
Yes.
And it works. Okay, so let's peek into the future. You think this Sargon implant, the big companies, or the distributors are going to come to you and say, Sargon, I want this implant?
They would have to. They would have to license it. They would have to, as a part of their armamentarium, they have to have the expandable implants, because patients are demanding it today. Patients walk in the office, they're demanding their teeth replaced. They're faced with the answer that it's not possible. You have to take it out, you have to wait, you have to do this. And we have a great group of patients that are sitting home worried about it and not having implants because of this. And that tackles that and increases the profits of the dentists that are involved, because they can handle those cases.
I've done shows, interviews with guys that are actually doing, and I've even taped them, where they're doing immediate implants, immediate loading.
Yes.
Okay?
Yes.
And even though they'd normally like to wait a couple of months or 4 months, again, they're saying, Randy, it's risky. I don't know about putting pressure on the bone. I mean, is that their only fear? I mean, what's their fear?
Yes, it is
that their
risky.
fear? They're just saying, I don't know.
It's failure. No, they're risky. I mean, who wants to do in everyday practice procedure that is risky and it can fail.
And you're saying it's not risky?
Not with the right instrument, with the right implant. I attended an implant course which was titled Immediate Tooth Replacement. I wanted to see what the competition does.
Okay.
And the instructor was going to do a demonstration of a screw implant being immediately loaded. He goes in there and he's twisting it to get the 40 newtons of force, and click, and the bone fractured. The buccal plate fractured. They cut the feed video and they said, we're not going to show this, and they didn't do it.
Okay, but in a perfect world, they slowly screwed in there.
No. The pressure that is required to solidify a screw, plus a screw, because of its design, can unscrew. So if the patient chews or does anything with this tooth, that implant loosens. So there's a requirement that patient cannot chew. You have to rely on your patient for your success. And that's not the way we want to go. You can't do that in everyday practice, to rely on the patient.
So they
not
could
to
chew, they
and eat.
could put forces right away.
I am talking about full function on the implant at the time of placement, which is unknown and unbelievable. Today the dentists are sitting, it's impossible. It is possible. I've been doing it for 25 years.
So do you have other dentists that are doing this also for
Yes.
10 plus years?
Yes.
They love it?
Are
there guys that only would do Sargon implants?
Only Sargon implants if the patient requires immediate replacement. We do manufacture regular implants, screw implants. There's some cases that the patient comes in as one back tooth, doesn't care about the bone has already been lost, and
Okay.
they want, they can wait through 2-3 months.
Now, I have partnerships or friendships and do business with the largest implant company here in the U.S. and also huge distributors of dental implants. And I don't want them to think I'm here siding with you, but you, I think, told me you'd like to work with them.
I would.
I mean, I'm paraphrasing you,
Yes,
but you implied that you'd love to work with them.
I would make this available to every company that wants to distribute it, and to actually, even if they want to license and manufacture it, because it should be part of their armamentarium offering. Imagine the world of mechanics and all that if only screw was available and the molly bolt was not there.
Could anybody, I mean, I don't know what to say on this, okay? Because it sounds, and I saw the animation, what could somebody argue? My oral surgeon buddy or my periodontist that has been doing implants for 25 years. What could they say that they say, I don't believe it, it's just not that easy, Randy? I mean, what could they say?
They say,
Could they argue with
They
any?
say they give you the same argument that they gave 25 years ago.
They're just
They said
feared. They're afraid.
No, it's impossible. What you said, you cannot put pressure on bone, it will dissolve.
So that's the big thing.
That's one thing, but that's been proven. Actually, right now, when the bone is soft, what they do, they drill a small hole and they tap it and widen it to put pressure on bone to put the screw in. So actually, they try to mimic these things. Now, putting pressure on bone has been accepted. That improves the quality of bone. When 25 years ago, when I talked about it, this was just out there.
Okay.
The other thing is, the other question that you asked is that how do you remove it? If you want to remove an integrated implant, there's a way. You can collapse
reverse it.
Yes, it's reversible. It collapses with the right instrumentation. You don't have to cut it out.
So standard implants, okay. So with forces, it moves, and the bone could kind of move away from the implant over
Yes.
time. Do they all, or just sometimes?
It's accepted that 0.2 millimeters of bone loss, all screw
Is okay.
implant, is okay, and it occurs with time.
And you're saying with yours,
It doesn't. You
you have X-rays to prove this?
25 years X-rays of cases that.
Then who
have
could
been
argue with
open.
this?
There's no argument. There's no argument. I
Okay,
would
good.
like
Good for you.
Anybody that is interested, I can come, show them the evidence.
How hard is it to learn? Okay, so let's say that I'm a periodontist or a general dentist that places and restores implants. How soon could I be up and running? What's the learning curve for a guy that already has experience?
For a guy that has
He's been
experience,
placing and restoring
I would
implants.
teach the technique, and it's basically, I have streamlined the technique to be very similar to what they've been doing, except the fact that once the implant is screwed in, there's another instrument that expands it to 25 newtons of force, which is, a torque wrench will do it, and we have electronic torque wrench. That's all. That's the only difference. But I have also streamlined the restorative process to be just like a regular dentistry, because I'm aiming this to
So
the
the
general
tops
dentist.
are the same.
Yeah,
And where they-
I want this general dentist to have this available in their office, where it's just regular dentistry. The top of it comes with traditional type of implants. You can take impressions, but the ideal one for the dentist is the one that just like a tooth. You place it, it's a tooth preparation. You put a cord, just like you put a cord on regular implants. take an impression just like a tooth, natural tooth,
Okay.
give it to your lab, and the lab gives you a regular crown with no screws or anything. You just cement it on top of this.
Then tell me this. Okay, for the guys that, because I have some guys that do, you know, thousands of implants. They've done 10,000 implants. I have another guy, 20,000 implants, placing and restoring implants, or
Yes.
placing implants. Are you, for that guy, could he just watch a video? It sounds like it's pretty, almost
Absolutely.
exactly the same.
Yes.
They could
yeah.
buy your implants.
Yes, yes, I can.
Could the first 4 be
have
free?
a conversation with them. And
Somebody watches this, I mean, the first 4 to get them started?
Why not? Why not?
Interesting.
I mean, you know, I can teach them over the phone and tell them what to do, and if they want, they can show me some cases. You know, before doing them, a couple of cases.
And
I'll make
USC did some
suggestions.
research with you on this?
Yes, yes, and
That proved that this is effective.
I have all the results, and unfortunately, I had to get the results by filing a lawsuit.
Okay.
So, but we have this logical results from Indiana University. We have the clinical results, microbiological results, immunological results. We have all of those that were not published, and that's why we filed the
But
lawsuit.
you have records of these?
I have the researchers
Okay.
on tape telling the results, and I have their
Okay.
writing.
How many Sargon implants have been placed, these expandable implants, over
Oh,
the last 25 years?
Probably over 100,000.
Over 100,000.
Yeah, I've myself.
Any rumor,
placed-
any rumor about what the results are? Because it's hard to keep track of all that.
You will never hear rumors from people that have done it or are doing it. I mean,
Like 97% success rate?
Yes.
Really, with
you know,
100,000?
They actually, in the process of the lawsuit, they took depositions of 6 practitioners, and one of them was the head of the oral surgery department at USC, and he showed 115
Okay.
implant that he'd done, and he said he had over 90% success.
Right
rate.
now, you have oral surgeons using these implants.
Yes.
And you have periodontists using the implants,
Yes.
general dentist.
Yes.
Do you have people that swear by these implants? Could my clients call your
Yes.
users of Sargon?
Absolutely.
Could I get a commission off of it? I'm just joking. Well, look, we're out of time. But,
All
you know, I met you through my show, and you got a lot of passion. You seem to be a very honest guy, an inventor, an innovator. And it sounds like it's a great implant.
Thank you. Thank you.
So good. The future, the distribution, are you going to reach out to some of these distributors, or?
Actually, yes. Now we're going to start because the challenges are over. You know, up until last year, we were all in the court and lawsuits and stuff. We won those. Now, our aim is to bring this and have it distributed by all companies.
Who should they call? Do they go to the website to order these implants?
This Sargon implants is being distributed by Biodent. Biodent. Yes.
Okay, good. Thank you.
Thank you.
Pleasure to have you on the program. You've been watching the Randy Alvarez Market Report. We'll see you next week.